the first capsule, we traced the history of St Boniface Hospital, but today we will explore in detail how this hospital has always served the community and how it has managed to adapt and grow through the ages to ensure quality, safe, and compassionate care. At the heart of St Boniface Hospital's origin are the Sisters of Charity of Montreal, also known as the Grey Nuns, whose mission was to help anyone in need without distinction, regardless of their religion, ethnic origin, or socioeconomic level. The Bishop of St Boniface, Archbishop Provencher, issued a call to bring nuns to Manitoba, to which the Grey Nuns of Montreal responded. Out of 38 sisters, 27 were ready to leave, and it was finally 4 sisters who began the journey west in 1844. Sister Marie-Louise Valade, the Mother Superior of the mission, Sister Eulalie Lagrave, who was the group nurse, Sister Gertrude Coutelet, also called Sister Saint-Joseph, and Sister Edwige Lafrance. These 4 women of faith began to care for the sick in a convent, but also began caring for the orphans, the elderly, and the disabled. Very quickly, the need for care became too great for the building, which led to the construction of the St Boniface Hospital that we know today, founded in 1871 and which housed 4 beds. It was the first hospital in Western Canada founded on the values of the Grey Nuns: compassion, respect, and dignity. 2 other key values were charity, as the care services offered were mostly free, and of course, universality. Although the sisters were Catholic and Francophone, they cared for everyone without distinction. The sisters soon had to take care of contagious patients, especially in 1894 with a smallpox outbreak. These patients were treated in the house next to the hospital, the Maget House. As the need for locations to treat contagious patients increased, the Saint-Roch Pavilion was created. It was built in 1895 to accommodate the first diphtheria patients. 4 years later, in 1899, the Saint-Roch Pavilion could accommodate 50 patients and became an independent hospital, the Saint-Roch Hospital. That same year, in 1899, the city of Winnipeg experienced a major epidemic of diphtheria and typhoid fever. An epidemic so severe that the Winnipeg General Hospital had to close. As a result, St. Boniface Hospital stepped up and started treating many more patients. This dedication to responding to the needs of the community with love and compassion goes beyond the purely medical aspects of care. In May 1924, the fragile economic situation of the time pushed St. Boniface Hospital to create an outpatient social services clinic to help the most disadvantaged. This clinic offered free medical exams and even dental exams a few years later. It also offered help with clothing, food, and medicine. Beyond the physical and social needs covered by the hospital, there is also a strong commitment to having a welcoming and open space. On January 1st, 2005, the hospital's pastoral care service opened its doors to all religions and became the spiritual support service. This service includes representatives from various faith groups. The legacy of the Grey Nuns is of course punctuated by their desire to offer quality care. However, what is also notable is their conception of health as a whole. We know today that art also has a therapeutic function. And in 2007, the hospital brought art to its patients and medical staff with the inauguration of the Buehler Art Gallery, a 400 square foot space located within the hospital. It is the first hospital art gallery in Manitoba and the first to have its own space in a hospital in Canada. In order to continue to serve its community, adjustments and improvements are necessary to keep up with the times. St. Boniface Hospital is an institution that has always managed and still manages to adapt to the needs of different times. In 1974, for example, life expectancy had become much greater than it was a century earlier, particularly because seniors and people with disabilities were living longer. And the sisters were there to meet these new needs with the creation of a new 200-bed extended care unit for this new segment of the population, with palliative care running alongside. This ability to adapt to the needs of the community was also seen with redesigns to the emergency department, or in June 1999, with the creation of new examination rooms and a reorganization of the cardiac catheterization laboratories, and 10 years later, new waiting and triage rooms. And this is just one example of improvement. The maternity ward and the intensive care unit have also been reworked to offer the necessary welcome and care to the community. Very recently this year, the psychiatry wing of the hospital was completely renovated to provide the best possible care for patients with mental health issues. We have spoken at length about the core values of the Grey Nuns, including the notion of compassion. This is also a value that is present among the nursing staff. In the 2000, St Boniface Hospital had the best nurse-patient ratio in all of Canada, 1 nurse for every 4 patients. This ratio allows for a more personal, adaptable, and compassionate care. Recognizing that the health of our staff is paramount to achieving our mission, the hospital opened a fitness room in 2000, Staff in Motion. The staff committee behind the gym also created programs to help employees with their mental health needs, such as the Employee Assistance Program and the Crisis Response Team. And in the late 2010s, early 2020s, a project led by the Catholic Health Corporation of Manitoba was adopted by St Boniface Hospital, the Patient and Self-Compassion Project. These are workshops and training in mindfulness offered to caregivers to learn how to develop this self-compassion and learn to live in the present moment. It is a program that has been used at all levels, including management. In June 1969, Director Anthony Quaglia succeeded Sister Delia Claremont and thus represented a transition away from clerical leadership at St Boniface Hospital. But the core values of respect, compassion, and service were retained in their entirety. These core values were reiterated in 1991 with a new mission statement, which emphasized a commitment to quality care for all, service to the community, compassionate and respectful care, and the Judeo-Christian values of the founders. Our founding values are included in the strategic plans of our institution, so that our focus is always on compassion and dignity. Take, for example, the Positive Steps Council, or With Every Step, You Make Us Better. This is a group of staff members from all sectors who work together on different missions around St. Boniface Hospital, such as improving the quality of life and work and internal communication. Let's also look at the most recent 2020-2023 strategic plan, which puts people at the heart of the action. A plan that led us to develop the first Charter of Patients' Rights and Responsibilities. This document sets out the fundamental rights of patients while promoting their active responsibility to the best of their ability in their treatment and in collaboration with our healthcare teams. St. Boniface Hospital has been through many changes throughout all these eras, but the core values of compassion and love for the communities have remained intact, allowing this institution to maintain its original identity and mission throughout these last 150 years. In the next video, we will look at the various accomplishments of this hospital, and especially its pioneering work in many fields.